like it.
I'm really happy to have you here.
Listen, if you're involved, I know it's cool and fun and all those things. So
keep it coming. Keep it coming.
Is this are we on like this is real?
Dr. Jain, welcome to the Carrie Croft Show. And this is a real start. This is not a fake social media start.
I think I peaked early.
How do I? Most men do, don't they? We'll get to that. What a great start to this interview.
It's all
this is going to be real good. Real good. How do I look, first of all?
You look amazing.
Like scale of 1 to 10?
Well, normally you're at a 10, but we'll go at 9 only because you had that little allergic reaction thing.
The situation.
Well,
You can't always be a 10.
You can't always be a 10.
But you're a 10.
No, I'm not a 10.
Yes, you are. You're a total 10. Are you kidding me?
No, it depends.
It's all in the mind. It's all in the mind. So, Dr. Jain, you are kind of a local celebrity. Let's be honest. I only bring celebrities in here. We're all celebrities, aren't we?
You definitely are. You have a lot of friends. I would not say I'm a celebrity. I think I'm just a guy who lucky to like what I do and have a lot of great patients like you.
Yes.
Can we say that? Did I just break HIPAA? I think I broke
You know
HIPAA.
what? How about this? We can break HIPAA because I have you on here as my fertility specialist.
Okay.
That's why you're on here, right? That's how we know each other. So yeah.
Yes.
Screw HIPAA.
That's like the only way a guy like me would ever get to know someone like you.
Oh, you know what?
It wouldn't be like a social, like, oh yeah, he's friends with so and so. No.
I don't know because you have a coolness about you. For sure.
It took many years to hone dorkiness and nerdiness into a, it evolves with time.
Well, listen. So for those people out there, I brought you in here because you were my fertility doctor, right? And you and we've been through it together, haven't we?
Yeah.
I have been through the ringer.
You're a tough cookie.
You're telling me, but it's perseverance, right? And relentless pursuit of your goal. And sometimes it leads to green pastures. Yeah.
I mean, I feel like you went through a lot of stuff before we met. Mm-hmm. I feel like it was a little greener.
Yeah, you're right.
And mainly because, again, you have a way to. You're a very, very strong person.
Well, thank you.
Yeah.
So my first question for you is: when did you know that it was your life's work to work with Vaginas, women's Vaginas? You know what I was thinking too?
What?
When I was thinking about this question, I was like, how many words can I think of to describe a vagina that aren't derogatory? So like vagine, hoo-ha.
Yes.
Vag. Are there any others that aren't like derogatory? There's one that look, he's already getting nervous. See, this is so good. We'll see if he can really hang. We'll see if Dr. Jain can hang with the Carrie Croft Show. My best friend's mom used to call it a potty shame.
Oh.
And it's funny. I think it was like a family name. But then I said to her, I was like, well, TT, why wouldn't we call it potty proud? And this is when we were younger.
Yeah.
So we've got the potty shame. Can you think of one other one? Add in just one. That's not derogatory. Just like a nice, friendly name for a vagina.
Yeah.
There really aren't that many, are there?
I mean, in the office, you use official terms.
Like vagina? What else? What other terms?
That's really the only term to use. Outside of the office, I try not to talk about it.
Well, you're probably so sick of vaginas.
So, people say that, and it's like you're so focused on your work that you don't even look at it as that.
Well, you know what I started thinking about? Because I've had a lot of time in these offices. A lot of time.
Yeah.
Right? I mean, you would come in and I'd have one pant leg on
I was telling my wife this story.
with the shoe.
Yeah.
Like I had mastered the art of being in and out of these doctors' offices. But I would get to thinking and I'm like, man, Dr. J and Dr. Shepard, Shep Dog, she's coming in. Like, how many vaginas are you looking at? But then I got to the point where I'm like, okay, they're not even looking.
No,
there's a sheet.
Yes, that's the point.
He probably hasn't really seen a vagina.
No.
You don't even look at it. It's just my sick, twisted brain.
Well, because you're usually thinking about like what you have to do, right? Now, in Dr. Shepard's case, I don't want to put words in her mouth, but when she's seeing someone for an annual exam, she has to take like a look, right?
This is true.
It's the breast exam, everything, right? So she's probably seeing more than someone like me, who I'm really focused on. Oh, I got to get this embryo transfer catheter. Oh, we're doing an egg retrieval, right? Or if you're doing an ultrasound, as you know, it's literally the room is darkened. You just go in, you put the probe in, right? So I think someone like like Dr. Shepard or General OB/GYN, they tend to see more,
she's judged
vagina.
the vajayjay for sure. That's my
Yes.
first. I'm going to put her on. The first question is, how many are you judging me as we're sitting here?
Wow. Yeah.
On what my vagina looks like.
So, obviously she is an amazing person. I don't think she ever judges anything. But I think, but I would say, like, if there's someone, or, an OBGYN could certainly, for lack of a better term, judge or assess, is maybe a better word.
We're going to have to see.
Yeah.
Okay, so
not the fertility doc.
Let me move out of my sick, twisted world that this is just this baseline for me, and let's seriously go into when did you make this decision? So is it kind of how it works in med school where? Because I've watched my sister Caitlin, how this all goes down. It's like you're trying to figure out based on like quality of life, how much money you're going to make, the altruism. You put it all in a thing, and you're like, and how smart you are, right?
Yes.
And what you're going to get into, and then you kind of end up. Is that how it works?
I think people are different. Everyone's different. Some people have a plan. So sometimes I'll have a med student ask to do a rotation with me, and I'm like, "You're a medical student. You're like, T minus 7-8 years from this point." But some people are already thinking of it. I'm one of those people that I just happen to not even know. I didn't have there was no navigation. I'm just driving along, and I just happen to make some turns, and somehow you just end up in what turned out to be the perfect place for you. So only because you asked the question, I'll tell you a funny story.
Yeah.
So, I was very young going through school. So I graduated high school at 17, and I went through a 6-year med program, so I finished college at 19, med school at 23, right? So when I was in medical school, I was literally 21, 22 when you have to decide what your focus is going to be. I was not in a mature place in my life to think about what do I want 20, 30 years down the road, right? So never mind, 5 years down the road. So I'm like, I want to do something that, is surgical because I enjoyed that. And I really like sports. So I was really into orthopedic surgery initially, except the smell of bone in surgery, especially when you're cutting it, right? It was like overwhelming for me. And I remember talking to one of my, friends who was an orthopedic resident there. And he's like, dude, this is what it is, like all day long. If you don't like that, like if you don't want that, it's like a carpenter not liking the smell of cut wood, or a landscaper not liking the smell of freshly cut grass, right? Or having allergies or something. I'm like, you okay? So it was hard for me to step away from that. But OBGYN offers procedures and surgeries, but you're also like, dealing with patients. And I still remember my my advisor in medical school, a wonderful woman. She said, I just want you to know that you are going to give up seeing 50% of the population. You will never see a male patient. You'll only see female. And until she said, I'm like, I didn't even think about that, right? But then I'm like, well, most patients are women anyway, no matter what field you're in, I feel like, except maybe urology or something, right? So it took me a second to think, but there's not much time to think. You only have like literally a matter of 6 months of thinking time in medical school in terms of access to like, I want to check this out or check that out, maybe a year max. So I applied to OBGYN and got in, right? And I thought OBGYN was so great. And it was kind of strange because the only male resident in my class of 7 residents in a program of 28, I was one of 2. I think 3 my first year, 2 my second year, and then eventually it remained 2 the whole way. But I thought I'd just be a general OBGYN. I thought I could be someone who's maybe a fraction of how great Dr. Shepard is. Let's put it that way, right? I was just like, I think this is great. My second year, I went in for a delivery and delivered a 10-pound baby that literally, I still don't know how this even came to pass safely. And I remember like my pulse was high because such a hard delivery, vaginal birth, on a patient who refused IV, refused everything. So it was like this or nothing. Like there was no backup plan. And I literally walked into this, never even had met this patient, right? It was a very scary Saturday morning, I remember. And I remember an hour after the delivery, I called my brother, who's sort of the person that I look to for guidance and stuff and advice. He's my older brother. I'm like, hey, I was telling you like last month about maybe, I want to, and it was actually, again, being a big sports fan, I was with him in January, weekend of his birthday, when during the Snow Bowl game, the Patriots made, finally the Tuck Rule game. Everyone remembers that game. Anyway, so we had watched that game together on TV. And so this is a month later. I'm like, remember I was telling you I was thinking about fertility? Yeah, I think I'm just going to do the fertility thing. And I didn't know much about it at the time. I'd never even done a fertility rotation at the time. I just kind of knew there was a few options in OBGYN. So, and it was the hardest at that time fellowship to get. So I'm like, well, why not? I'll just give it a shot, whatever. And it worked out. So, to answer your question in a very long way, and I apologize for what like leads someone to do this.
Yeah.
It's sometimes you try something, you're like, oh my gosh, this is amazing. It's super scientific, cutting edge. What I never realized at the time, because I was too young and immature to really appreciate it, but now is the main thing that drives me is you just get so attached to people. You know them for a small amount of time in their entire life, but in that small time of attachment, you do something that's with them forever, right? And so you never realized that as back then a 24-year-old, right? Thinking about this decision, 25-year-old when I was applying. Now I look back, it's not about the science or any of that stuff. It's about those relationships and those memories and also the fact that, as you go through a cycle, there's an outcome. So it's almost like you get a report card like constantly, right? Whereas let's use the orthopedic example. Let's say I was a decent orthopedist, right? I'm not head of blah, blah, blah. I'm just a regular good orthopedist. I'm not taking care of professional athletes. I'm just taking care of regular people, right? Like, 40-something-year-old guy tears his meniscus. Well, you fix it. As long as they're walking and jogging in, job well done, right? Like there's a big, whatever the difference is between doing a not great job and perfection, there's a huge gray area in all of medicine if you think about it. But in our field, it's got to be either perfect or it's nothing. Mm-hmm. It's not like, oh, hey, you had a miscarriage. I tried, I did a good job. It's like, no, that's terrible. Like, in fact, one of the reasons I was a little bit late today is I had to give someone bad news about a potential miscarriage, right? So that appointment went longer than normally it would. When it was normally it's good news, right? So I think when you're dealing with people, and I'm fortunate, when you see a lot of patients, but as you go through like these names of patients in your memory, and you're like, oh my God, yeah, they had a baby. Oh, they came back for baby 2 or baby 3, right? Like it just stays with you. It stays with me, as now these kids are growing up. It's my 16th year out. So somewhere out there, I have a few babies getting their driver's license this year,
Isn't that
right?
amazing?
That's pretty amazing. Like crazy for me, right?
So were you the second fertility clinic in Columbus?
Yes.
That's crazy to me.
Yeah.
I mean, so you actually were in it at an interesting time too. I mean, I feel like fertility has just like, I don't know if it's, I'm gonna get same-sex marriage has got to be a huge part of it.
Sure, yeah.
Or more people, heterosexual couples are infertile. I don't know what it is. Or maybe people are like seeking treatment earlier, or now that you can find out the sex, some people are doing it when they don't really have to do it, which, okay, great. But you were the second clinic in Columbus and you just blew it up.
So I've been in Columbus for 10 years. Our office has actually been here, I think, for about 15 years. But, it was really after I came that we had a steady presence the whole time. My partners, who were mainly up in Akron, they were sort of supporting this office. But I think, the other group has been around for a long time, right? Mm-hmm. For 25 plus years, I'm sure. There's some older docs in the group, some younger docs too. But I think that, but your question is a very good one. Like fertility, the comment you made about fertility blowing up, they've actually been saying that now for like the last 15 years. Like, oh, fertility is blowing up. And the thing is, it's blowing up in the sense that there's always more and more of it. Mm-hmm. Sadly, it's almost like saying, is cancer blowing up? You can say with earlier detection, there's more cancer that we find as physicians, right?
Yeah.
But also faster and better treatment. So the survival is more, right? So you have more cancer survivors now than you certainly did ever. With fertility, I think all those things you mentioned, by the way, a wonderful job, Carrie, maybe you got some potential there as a fertility counselor.
If you need some kind of commercial over here, I'm your girl. whatever you need.
I feel like you're the kind of person I'd come to for anything.
Pretty much a jack of all trades, master of
Anything.
none.
Yes.
That's me.
Well, I think you master a lot of things. I'm looking around the studio. You mastered this thing pretty well. But, I think awareness obviously is huge, right? I think there was a time when things were a little more taboo with fertility, where I think now it's so common. I mean, in groups of friends, we see it all the time, right? Like,
thank God, though.
Yes.
Not that people have it, but
Correct.
that people aren't feeling like they're in some weird, land of the misfit toys.
yes.
And that's a horrible feeling.
Well, I think it's a horrible feeling for that person or that couple because it's something that shouldn't, it's the most natural thing of any species, right? It's something that people have done 1 trillion times over again successfully. And it's like, why is it that I have, sorry, I keep doing that.
Okay.
So why is it that I have such a hard time getting pregnant when all these other people, all these relatives, friends, right? People younger than me, people older than me, whatever. So I think in that sense, it for some people it could be an isolating feeling. But I think as people tend to talk about it more and talk to their friends about it more, it's amazing how many people have struggled, right? But to your point, sometimes it's not always a struggle. Sometimes the struggle is, I have 3 boys. I really want to have a girl, or, I have 2, whatever it is. Same-sex couples. I mean, I don't think it's a struggle if 2 women get married. But yes, having a baby can be hard because you're missing that one other factor. Luckily, there's treatments for all this stuff, right? So at the end of the day, the goal is that everyone gets what they want. Everyone gets the life that they want from this intervention, call it what you want. But I think, but that's all a part of the growth of our field and the growth of patients being, intelligent, well-informed. I feel like most of my patients kind of have an idea about what's going to happen at the first visit now. Whereas before it was like, trying to even spell IVF was like, whoa, what is that, right? Everyone pretty much knows now, right?
Yeah.
And if they don't, it's fine, right? But I think that it just goes to show the level of awareness that people have.
Now, you've got to be rolling in the dough over there. Like where and don't let's not, put smoke and mirrors. I want you to just be straight with me here. Because fertility, you gotta those are real expensive treatments, and it's okay. You've earned it. But where is that in terms of dermatology is like, they're going to make bank and they have a great lifestyle. Like I've learned a little bit about kind of like the different fields just from my sister.
Sure.
Where is the infertility specialist on that realm of like, they're going to make bank, man? But where is that? It's got to be up there.
I mean, listen, in the grand scheme of all jobs you can do, it's obviously way up there, just like any kind of physician would be.
No, you're doing that. I mean, but it's a lot, right? I mean, it's good. It's a good, there's good money there.
Yes.
There's good cheese.
I don't think any fertility doctor should ever complain about their income. Now, sometimes we feel like we should be making more because one of our colleagues is doing less and making more, blah, blah, blah. All that stuff, right? Grass is greener kind of stuff, right? We're keeping up Jones, whatever the word is. But I think, I think all doctors work hard no matter what field you're in, right? I used to joke, radiologists, how hard are you? Sit around in a room, sip coffee and whatever. When I talk to my friends who are radiologists, they're like, yeah, I just did 8 hours and I couldn't even get up to pee because I had so many films to look at. And I can see how every field has its own way of, right? Mm-hmm. You might sit here and talk to someone as a psychiatrist, but I think even talking to people over time can be exhausting, right? Like when I do telemedicine, I find I'm more exhausted after 4 hours of telemed than to run around the office for 4 hours, doing procedures and ultrasounds and stuff, right? But you can see I'm trying really hard not to answer this question.
No, the next thing I would say, give me your, I want to see your W-2. Let me see what's going on.
Well,
no, do you have an indulgence? Like you got those Gucci slides at home? Like,
I'll tell you a funny story about Gucci slides. Mm-hmm. So, listen, we all like nice things, right?
Yeah, but I'm just curious. I want to know what Dr. Jain wears when he rolls out.
Yeah, I am the most boring whatever person there is. I've had a couple of cars that I thought were nice, but when I compared them other people, it's like, whatever, dude. So it's so funny. I have a patient. She's had a couple of kids now, but I remember one time, so I come in to do the ultrasound, and as I'm doing it, something in the corner of the room catches my eye. I thought it was a small Pomeranian or something like that, right? And it was
Pomeranian.
well, yeah, I thought it was like
What's a Pomeranian?
what are the Poms? What are those dogs? The little ones, the furry ones.
I think it's a Pomeranian.
What did I say?
Pomeranian.
Oh,
that's amazing. I'm not editing that.
I'm nervous.
I'm not editing that.
I should have taken the shot that you offered me. I don't have to work anymore today. I probably could have done it. You know, it's fine.
I love it. Keep it moving.
Okay. So anyway, in the corner room, there's this furry thing. And so it like catches my eye. And, I finish all. So I'm like, I'm sorry. She asked me a couple questions, whatever. I'm like, okay, by the way, what is that? And she's like, Dr. Jain, you don't know Gucci's? And I'm like, looks like a furry pet. And she goes, those are my shoes. And it was like I remember it was like a rainy, slushy day out. So I'm thinking like, don't those get dirty? Like if I'm going to go drop $1,000 on a pair of shoes, like I'm not wearing them unless if it's like perfect out, right? But anyway, so yes, I do not have anything super fancy. I wear like an Adidas Stan Smith or whatever, On Clouds, which every dad wears now, right? Mm-hmm. Like the best walking shoes or something. Nothing real fancy.
You don't need anything when you're this handsome. You don't need anything fancy. Gosh, you know what I'm saying?
That was an unexpected compliment, which I totally appreciate.
Good. I don't give them unless they're true.
I'm the most handsome man in this room right now.
You are. You have that title. You absolutely. So how I want to talk about what you're seeing in the office. So the idea of an older mom, I'm sure that has to just be like a ton of your clients, right? You're seeing a lot of women, and we call them geriatric, which someone please find another name, please.
I
know. Like moi. Do you see what's the percentage right now of, let's do this, just in your back of the napkin math.
Sure.
So same-sex couple, woman over 40 trying to get pregnant, and then just unexplained any age heterosexual infertility. What's the ratio of who you're seeing?
Yeah. So I have to we'll have to make sure this all adds up to 100 here, but in the order.
Let me get my calculator out.
So, in terms of unexplained, that's probably like 45% of the patients we see, meaning everything's generally normal in terms of sperm. Everything's generally normal in terms of ovulation, like they get monthly periods, right? I know a lot of patients like to split hairs on, it was 28 days this month and 29 days or 30, as long as it's pretty monthly, within 40 days, normal, right? And then, so that's ovulation, right? And then fallopian tubes being normal. So in our general, suburban population that I see, it's probably about 45% unexplained. In terms of like strictly male factor, right? So that's probably a good another maybe 15 to 20%, I think. And then, block tubes or things like that, like a strictly female phenomenon. Block tubes are pretty less, maybe like 5 to 10% max. More than anything, and sort of overlaps a little bit with that unexplained, is diminished ovarian reserve. So women whose ovaries are acting older than their age, and sometimes you have women who might be a little bit older but very well put together like you are, and they look really young. It's very hard to come to terms with the fact that I've done so much to take care of myself, but my darn ovaries are acting my age or older. Right. Mm-hmm. That's probably the toughest thing to work with, because really those are your resources, right? Is what do you have for eggs, right? In terms of same-sex couples, it's probably about 5 to 7%, which is, we see a fair number, but it's in the general fertility population, it's still overwhelmingly, heterosexual couples. Mm-hmm. But obviously that same-sex couple number has grown just so quickly over the years. Before it was like maybe one you might see a month or whatever, and now it's several a week, which, that's the sign of progress, right? So I think that kind of breaks it down in terms of really the main causes, yeah.
Do you find yourself, especially in those initial consultations, being sort of like a therapist too? I mean, do people just, I can imagine people are, not everyone, but I bet you there's a lot of people who are struggling with their relationship at that point, struggling with functioning as a normal human. I mean, infertility can really take you down.
Yeah.
So by the time they get to you, you're kind of this like, oh my God, he's gonna fix this. He's gonna make this all better. So when they walk in your desk, you probably feel a huge responsibility. But do you see a lot of emotion?
Oh, absolutely. I mean, I think it's an emotional field, right? I think my, speaking for myself, my emotion comes in as you get like to the outcome, because that's really the part that I affect, right? Or I shouldn't say just me, we as my office and the people that I work with, that's what we're working towards, right? People do often come in with, tremendous, I don't want to say baggage, but emotional wear and tear, because they've been in, and everyone's different, right? Some people come in with a history like, oh my God, how did this patient even survive that? Delivered a baby that died at birth, right? Like, how do you weigh that compared to someone who has been trying for a year and just hasn't gotten pregnant, or someone who, and if you talk to the person who's been trying for a year and who's otherwise made everything else in their life so perfect, that's a huge deal, right? It's not fair to compare that to like, well, I just saw a lady who had a miscarriage, at 22 weeks and, whatever, and got to physically see, unfortunately, this unlive baby that she delivered. Like, those are terrible things that we wouldn't wish upon anyone. But it's just like, it's like everything in life, right? It's relative, but when it's us, it's the most important thing. So I think, when I see new patients, and I'm sure I'm different today than I was 15 years ago, right? But just because you change as a person. I think I certainly respect the emotional aspect of it, but I also feel like I have a job to do, right? Which is I have to get this couple, their family. And by the way, it's not just getting pregnant, because that's true. It's pregnant, but you also have to think about long term. So today I happen to speak to a 35-year-old who's got fairly low, but not terrible ovarian reserve. They've never been pregnant before. They've been married for like a year, and they really want to have 2 to 3 kids, right? So can we get them to 1 baby? Probably pretty easily. Maybe in IUI, right? Intrauterine insemination, that might work. But when she comes back at 37 for baby 2, or if we got lucky then 39 for baby 3, it's probably not going to work. And the difference of this patient and this couple feeling like they've totally achieved what they wanted to achieve is having 2 or 3 kids versus 1 kid. I feel like I failed them if I didn't help them get what they wanted within some scope of reality, right? Now, if you see a 46-year-old who comes in and wants to have 3 children, there's a time there that you probably won't even get to 1 without, let's say, donor eggs in that patient, right? So I think when you meet someone, yes, they bring a level of emotion to it. Your job as a fertility doctor is to obviously, to accept that, but to also, what can you do to set, a plan and expectations that this couple can sort of take that information, process, this is what it means for them, and this is what they'll be able to achieve, right? I mean,
speaking of the 35-year-old that has low ovarian reserve, would you do IVF immediately to try to pull eggs out to get the best?
I think in modern day fertility, you have to at least consider and offer that. I don't think I can say, oh, well, they haven't even done anything yet, so we're not even going to talk about it. No, I think it's my job to bring that up and say, listen, let's plan this out. Let's see how this plays out. Because, and especially now at this point in my career, you've seen all of these scenarios play out, right? When you tell a 40-year-old, okay, we have 1 genetically normal embryo, it's going to probably give you 80% chance we'll have a baby from it, but that's it. Are you okay with that? And if they say, oh, yeah, we just happy to have 1, we'll figure out the other stuff later. There is usually no later. Because if you come back at 42 and you're already, let's say, low now that you only were able to have 1 genetically normal embryo, what's the chances at 42 where the chance of normal embryos goes down, from, let's say, 25% to 15 to 20% in those 2 years, right? It's a big drop. And so for that, I'm talking per embryo here, right? So for that patient, I'll say, listen, if you want to have 2 kids, we either have to do IVF again and, save this embryo, get another one, or we need to, just be happy with 1, right? So for this 35-year-old that we're talking about, I would say, if you really feel that you need 2 to 3 kids to be happy, you almost have to do IVF. unless if you just get really lucky now and you can come back in 2 years and we can either do IVF then, or we can try and get lucky again. And then maybe at that point, you're just happy with 2 kids. And the other thing is, the truth is, we don't know what we really want until we have at least one baby. I find that people who say they're only that they're happy with 1 kid often really are the ones who really want to have a second kid after having had 1. And I feel that people sometimes who want to have 3 or 4 kids after having 1 are sometimes just happy with 2, right? So sometimes, because we change in how we
Well, then
think,
once you finally have the kid and you're like, holy shit. Like, then you're like, whoa, 3 kids? What? I mean, that's like, insane asylum.
I know.
Random question. What is the most eggs you've ever gotten out of one retrieval? Like, is there one that stands out where you were like, holy shit?
So there's 3. There's 3, yeah. So one was back in Jersey where I had, I think it was 74 eggs retrieved. And she's polycystic. She had a lot, right? So we knew we'd get, okay. So the things, when you go into that, you don't go in saying, I'm going to get 74 eggs. You go in thinking there's a lot of eggs. And because you can't really count each one because the way an ovary is on ultrasound, right? They're all kind of mushed together.
But were they all good eggs? They weren't all good eggs.
No, they weren't. But she probably could have had like 10 kids from that. But since this is a relaxed show, I'll tell you, since coming to Ohio in the last 10 years, I've had 2 patients. The 2 highest numbers I've gotten were both 69. I honestly believe that my embryologists were like, I bet you there's like 72, but they're like, no, we just got 69. We stopped counting. Because here's the thing. How can that happen twice over the course of this happened over like a 4-year span, and it happens to be 69?
So, okay.
That's crazy to me.
So you do ultrasound, so like she knows it's coming that there's a lot of eggs.
Yeah. But nobody expects that many.
But like, you're like, whoop, whoop. I mean, most women are like.
Yeah, both those procedures, I'm like probably 30. But so one lady actually came from, like, I'll just say it, I won't name this, a city in the Pacific Northwest.
Okay.
Right. So she came through word of mouth. She'd failed several IVF cycles because actually her problem was her AMH, a test for ovarian reserve, was I think like 42 or 43. It was really high. And every other person, every other doctor who tried to stimulate her for IVF would either overdo it or try and be too controlled, and they weren't getting enough eggs. So through word of mouth, I think she'd done 2 retrievals in the past, canceled a few also, came here. She's now already had her 2nd kid from this original cycle, but this is one of the 69 egg patients. And I mean, she had so many embryos. We only tested, I think, 8. That's all we needed. And there was half of those were normal and 2 of those are babies now, right? But I think, you don't go into it thinking this is what I'm going to do, right? Like I don't think you can possibly do that. Remember, and you don't gain anything by getting that many.
No.
Like it's not a badge I wear. Probably I got 6. I got 74. It's because that means the truth is you probably could have done the same with a lot less. It's just hard to kind of control it.
Yeah. I mean, and that's just like an outlier.
Yeah.
It's an anomaly.
It is.
Because most women, when you look on the Google machine and you're looking in the forums and stuff,
yes,
that like if you're getting 10 eggs, you are mother hen. You've done it. You've arrived.
Sure. Depending on how old you are, 10 is plenty, right? And obviously if you're older, then sometimes 20 is not enough. So I think a lot of it is, and you already know who's going to give you a lot versus very little, right? This is all things as a doctor you're already sort of expecting, right? So, yeah.
So are there, what it seems to me is like, there's such a mystery behind getting pregnant, obviously. It's like, oh, it's a miracle that it ever happens. And like, obviously you can't see anything.
Correct.
Because it's microscopic and it's inside your body. Like, what are the advancements being made right now that we're going to see in 20 years? Are there any more? Like, are there?
Yeah, I mean, there's been some advancements. Obviously, from a natural fertility standpoint, there's been very little. In fact, we're probably worse today at natural pregnancy than we were 10 years, 20 years ago, right? Or in our parents' generation, 30 years ago. We're just, who knows why, environmentally, or, it's also the thought that if your parents needed fertility treatment to have you, there's a greater likelihood you may need fertility treatment to have your own kids. Not always, but it's something that could be a genetic thing that we can't really identify, right? And you know, for instance, we have 50 to 60,000 IVF babies a year in this country, maybe more now. It's probably a stat from like 5 years ago. I mean, all of those people are going to go on to have children, and that's more fertility. It's more fertility babies that are probably going to become fertility patients. So if you are going to buy stock in a field that you think may increase in volume, unfortunately, for lack of a better term, it'll probably be fertility more than anything, right? Because it's just one of those things where you can treat the problem. It's very hard to say we can prevent the problem. So like, you know, we'll see young ladies that are planning, let's say, something that's going to take a significant amount of time, you know, let's say career-wise or something, right? You know, a third year out of law school, wants to, you know, make partner in her practice, and it's going to be a decade of just doing it, right? Just working hard for, you know, no time for anything, especially in terms of having kids for that person. Unfortunately, they may choose to freeze eggs, right? So that's someone who would have been a fertility patient who is kind of a fertility patient in terms of freezing eggs, but will hopefully find great success in the future as a result of that. So,
speaking of that,
yeah,
I really love that women are talking about this now as like an insurance policy. I mean, I never even had, that wasn't even a glimmer in my eye when I was that age, right?
Yeah.
And so I think now, and again, there's still cost to it. It's still scary to think about shooting yourself up with hormones. It's still not the norm, but I do believe that women should understand that is something they can do, because I mean, you know, again, like you end up, life goes by fast, and next thing you know, you're like, oh, I froze my eggs. Like, how great is that? How much of that are you seeing?
More and more. I think I do egg freeze consults regularly now, whereas before it was like maybe once a month or once every couple weeks or so. So what's great about egg freezing is, you know, we have to be careful in that we don't want to call it an insurance policy.
Okay.
Because that implies, like insurance, you expect when you need it, it pays out, for lack of a better term, right? Like no one would get a car insurance policy that maybe not covers you if you get into an accident.
Right, okay.
You know, right? So I think depending on, so today I did an egg freeze consult on a 39-year-old who I have no idea. It was a telemedicine. So I told her, I'm actually going to see her back in a couple days in the office this time. We'll do an ultrasound and blood test. We'll know immediately where her ovarian reserve is, and that's when I can really guide her as to, is this even worth it for you? Because when you think about embryos in a 39-year-old egg embryos, right? Those are probably about, you know, like that 40-year-old, about 25% chance of being genetically normal. So to get to one embryo, I probably need at least two fertilized eggs. You figured you lose some along the way. So if you do the math, and this is how I usually explain it to patients, I always work backwards, right? So you think about like, okay, if it's 25%, just like a 50-50 coin flip, doesn't mean you're definitely going to catch heads on 2 flips. It could take 5 flips to get a head, but let's just play the percentages here. You need probably 4 blastocysts, day 5 embryos, 25% each to get a normal one in that patient. You probably need about 8 eggs fertilized to feel pretty good about getting to that 4. If you're younger, maybe 6 eggs, right? But let's say not 39-year-old. So when I see her, I'm thinking, can I get 8 mature eggs on this young lady to even give her a real chance, right? And there's a little bit of loss, as good of a job as I think we do in my office in terms of egg freezing, because it is a very delicate process. It takes like 22 minutes to freeze an egg. So you can only imagine, like, you know, the time-intensive process it becomes and the level of detail you go into with each step of it, right, to do it well. So even in that situation, there's a little bit of a loss compared to fresh eggs. So if I'm going to freeze eggs on this 39-year-old, I want to feel like I can get at least 8 to 10 mature eggs from one IVF cycle. And if I can't, I mean, I'm going to tell her that. I'm like, listen, you might get 5 or 6. You might have to do this twice. Is that something that you want to do? And if the answer is no, then I would say, okay, well, we could do it once. We may or may not have enough. You might feel good you have some, so some chance is better than no chance, but understand you are taking a bit of a risk here. And, you know, again, as long as it's a conversation, as long as both parties understand what they're getting into, there's very little overall risk to the process, really financial risk more than anything, right? But I think a lot of that is just the conversation per patient. Like, for instance, I might see someone, who's a resident, let's say a local OB-GYN resident, we'll say, right? And let's say she's single, doesn't know where she's going to be, blah, 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 when she gets her job, et cetera. She just wants to freeze eggs. She doesn't have to worry about it. But she's got, a tremendous amount of ovarian reserve. That's a patient I might say, you could do it if you want. You're not going to regret it necessarily, but you're good here. You could probably wait a year or two. Maybe you're in a relationship. Maybe life changes, whatever. Maybe we revisit this in a year. And at that point, if you're in the same place, fine, we can freeze then. And I can think of several people off the top of my head, they never needed to come back. They met someone, they decided that's the route they're going. Within a year and a half, they happen to get pregnant, right? But I think at least looking into it makes a ton of sense.
So you got me thinking when you started talking about the process and freezing the eggs and all that, man, like when you're in that situation as a intended parent and you got your embryos in the hands of this, like Dr. Jain and his fertility clinic, my mind would go, because then you name them, right? So my embryos are like KC, KC5, KC6. Remember me texting you where I was like, yes, can you please make sure that this is the right now? I mean, because you're like, how do you know that like Dr. Jain didn't just drop one?
Oh, gosh, yeah.
I mean, of course you're not going to drop one, but I'm saying, how do you know that like this isn't somebody else's, like, and you've seen these horror stories. How do you, so not only that, where you see a horror story where this baby comes out, unfortunately, and it's just like not even looking like, that's one thing. But then like whatever that thing that was happening at Cleveland where
the embryo storage mishap.
Oh my God.
Yeah.
How do you have to have backup after backup where
you have to have checks and balance in place. Like it's a tedious process, right? QA, QC in general, and no matter what field you're in, is a tedious, boring process. But that is why it is what it is. If it was an interesting process, that means you're failing in a lot of places that you need to troubleshoot. When everything's fine, but you have to keep checking, that's what prevents mishaps from happening. Obviously, I don't know the absolute details of what happened in Cleveland, but yes, we've all heard stories about the wrong embryo or blah, blah, blah. I mean, listen, these are human beings that are doing this, and all human beings are subject to some mistake here and there, but there are some mistakes you simply cannot make, right? So whatever the reason is, there's no reason, there's no excuse. So we have checks and balance in place, and I'm lucky to have a really amazing staff of people that they don't cut any corners, Do
you have any dreams where you wake up sweating that you like screwed something up really bad? Do you have any recurring like fertility doctor dreams?
Not like screwing up stuff necessarily, but I have lots of dreams about what I do. I dream about what we do. Like, actually, I dream more about work than anything else.
I can only imagine.
I don't know why.
I mean, I want to set the seed for people because it really, I'm going to give some imagery here because I've been in that room with you. I mean, how many times? Like 5 or 6 times, 2 times with my surrogate. So we've been in that room together a lot. So you go in, you put the robe on, the hairnet, and this lovely lady, brings you into this small room that looks like an exam room. Not quite like maybe a mini OR, but not as like,
small OR,
And then there's this window, like a drive-up window that you would have, and this embryologist is on the other side of the wall, and they lift it up, and there they are. It's almost like you're getting a cheeseburger, but not a really important cheeseburger. Yeah. And then there's a TV screen up there, and then Dr. Jain rolls in, man, and he is like on one. You're on one. You are just like going, and you're in your element, getting everything going. And then next thing you know, you get on the table, you put the catheter in, the screen pops up. There's an embryo. You have to repeat all your information. It's actually gives you chills when you're in there. And I even asked the nurse, I'm like, do you feel this every single time? Because it is like, it's like no football game or any kind of competition you've ever experienced. I mean, it's like real life shit, right? So you're in there, you've got the catheter, and then what do you say, like, ready? After we confirm that all, and then you say something.
Yeah, well, I'll tell you. So the embryologist, what they do is, so they have their catheter. They have to go through a flushing process, right, to prime it. So while they're doing that, they don't load the embryo into the catheter until I say I'm ready. So once I put my catheter in the uterus, lower cervix, upper cervix, lower uterus in place, then I'll say I'm ready. And we're usually fairly timed, so it's not like I'm sitting there and she hasn't even started or he hasn't started,
Right.
where they're ready and I'm like still, talking to you about whatever, right? So it's fairly well timed. But, every now and then, like sometimes they're like, oh, I'm gonna have to reflush the catheter. We got a bubble. Okay, fine, whatever. I'm in place, or et cetera, et cetera. So I think it's muscle memory. So anything that's muscle memory, you just do it. So like the whole cleaning process and everything, like it just I don't even, if you said, hey, you did 4 transfers today, can you describe the cleaning of any of them? Or can you describe it? I'm like, if there's something really tough, I'll remember it. Most of the time though, it's like muscle memory, which goes back to my point, right? Like the science, the procedures, they're all meaningless in terms of the reasons why I went into the field to begin with. Now it's about, oh my gosh, I have so-and-so. They have 1 normal embryo left. They have a baby from 3 years ago, 2 years ago, and this is it. If this fails, they're going to be the parents of 1 child, and that is all. There is no coming back because they have no eggs left, whatever, no options left. So there is this tremendous amount of excitement, but call it pressure, excitement, whatever it is, right?
It's a big game.
But you feel like you got to make this work. Like this is not the time to be like blah, 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 right?
So you say, I'm ready. And then the embryologist walks out.
Yes, they come through the door with the actual embryo in the catheter, and then they take off the outer sheath and they feed it through. So I do what's called a pass through.
Yeah,
they pass through the catheter, which is already now through the vagina and cervix. So it's a very clean entry. Vagine, vag, whatever. All these.
Hoo-ha.
We should have listed.
Say it. You say it, but then say it with hoo-ha. That it's now through the hoo-ha. It'd be really funny if you were being technical and you're just like, hoo-ha. And now the catheter's in the hoo-ha.
You know what? You remember what's that Scent of a Woman? Al Pacino?
Why do I have to take things down to just a seedy side alley? You're in the middle of something and I take it down. Yes, I have seen that.
Yeah, he's saying hoo-ha, right?
Yeah.
Well, now if I ever watch a movie again, I'm just like, ugh.
Hoo-ha. Yeah. So then all I know, back to this beautiful imagery. So you say, and then you say, here it comes, see it. And it's literally this little light, like this little like soul, like it's, I could cry thinking about it. It is unbelievable. And everybody just watches this thing start to drop slowly into your uterus. And everyone just is in this room witnessing. And for someone who's never experienced infertility or even had to deal with that, like that's like, wait, what?
Yeah.
Like it's truly unbelievable watching science meet this, spirituality and the humanness and the fragility and miracle of life. It is crazy. I still have all the videos. I have Dane and Kyle on. I mean, all the girls that or Jade and Hope. I have them all. In like watching them go in. It's crazy. It's wild what science. I mean, it's just such a beautiful gift for people.
And so what's funny is I'll have a medical assistant doing the ultrasound so I can see, which is so crucial to get a good look. The one I do most of them with, her name is Emily. And I told her, I'm like, think about like everything that goes in this process, even to get to the starting point, then it's the injections, the procedures, the injections, the visits, ultrasounds, blood tests, right? Procedures, what the lab has to do once we give them the eggs and the sperm and making those embryos and biopsy and testing those embryos and which embryos are normal. And everything comes down to literally maybe, setting everything up is one thing, but the actual time the embryologist is walking into the room with the embryo and the time we release it into the uterus, 20 seconds, 30 seconds max, right? Everything comes down to that. If we were to not do well with that or something goes, doesn't go according to plan, I feel like it ruins everything.
Who's calling you?
I have no idea. It's probably a robocall.
You should answer it. You should answer it.
I'm not answering this. Okay, I'm going to answer this one.
You should.
Okay. Hello? Are you sure? Wait, who's this, please? Oh, hey, how are you?
So there's no more like octo moms out there, right?
No.
Okay,
no.
so you have no doctors now can't say, well, let's just try to put 3 in, or let's try. No one does that anymore.
Nobody does that anymore. Nobody should be doing that. Now remember, just because there's like 500 practices in the country that do submit their data to this national organization called the Society of Assisted Reproductive Technologies, right? They're under ASRM, the American Society of Reproductive Medicine. There's a lot of practices that just don't engage in any of that, and they just practice the way they practice. There's no there's no one watching them. They're not held to any standard, for lack of a better term, because they're not submitting their rates. So I'm sure there's people out there who are sort of pushing those envelopes. That Octomom thing was just so ridiculous and so unlucky in a way. And granted, there was tremendous risk that was taken, but then it was also like so unlucky. So you add it all together, and that's perfect, recipe for a national story, which really then set off like a domino effect of like rules and regs. You can't do this, can't do that. Sadly, you hate rules and regs for anything when they're not needed. But in this case, it's a growing field, and you got to pull people in.
What about that crazy male doctor that was using all of his own sperm?
That's the Netflix show, right?
Uh-huh.
I don't even know like why anybody would want that.
Oh, because it's almost like a serial killer, but in a whole different way. Like it's a sick, twisted. Like why you would want he probably became a fertility doctor for that specific reason. Did you watch the show? Or is it like too close to home where you're like, okay, I'm a male fertility doctor. Like I don't want to even be.
So I would have watched the show, but I think it was called Our Father.
Yes.
And that really freaked me out a little bit, right?
Yeah.
So I think I just saw the trailer. Like, I'll be honest. I can see how I see the story play out, right? Like, you're like, okay, so he used his own sperm. Why? He's probably nuts. Who knows, right?
Yeah.
I can't think of any reason why anybody would do that. But I also feel like it's one of those things where, there's got to be some pathology there. I think there's some pathology there, and they happen to be a fertility provider.
Yeah.
Right? I hope to God it's not like you're a fertility provider and therefore you did this.
Oh no.
Right?
God,
so
no.
it's scary stuff though. But patients ask about it. This today I did.
They ask about what?
Like they'll make some comments like, "You're sure that's my husband's sperm, right?" And I get it. So today I personally feel like maybe it's wrong when you're so sure of yourself or so sure of something, you can joke about it, right?
Right.
So today I did a 7-week, 2-day pregnancy scan on a patient, and I remember it measured 7 weeks, 4 days. The crown rump length or the early fetus did, and the heartbeat was great. This husband is like 6 feet 4 inches tall, and he's standing like right there, 5 feet away from me in the room. And I'm like, 2 days ahead. I'd expect that from a tall guy like you. And then the wife goes, "Oh, well, she's like, would you see that already?" And I'm like, probably not, but at least it's a greater likelihood that we use the right sperm, which I was just joking with.
But you know
right?
what? This is what I love about you. You have such a demeanor that like you probably get yourself in trouble sometimes. I think it's hilarious. Like that to me is really funny. Like, do you get yourself in like do you ever do foot and mouth?
I would say more than if you ask my wife, she's like, "When is your foot not in your mouth?" I think I do, but I'll tell you this.
I think I do,
but I think it's never ill intention. No. It's more just like there was a tension in the room. She was almost in tears when I walked in the room because she was so nervous as there going to be a heartbeat, right? But it looked great. It looks great. Some of it's just like and like I said, you get attached to people. You get and sometimes maybe I'm the one who gets attached more than they do, and they're like, "Dude, you're just a doctor. You leave the jokes out of it. Just give us, bye-bye." So I think some of that is just feeling too familiar with people at times, right? But at the same time, I hope if I've ever offended anyone, first off, most people, they probably, if they're offended, they don't say anything because they're so nice. They're like, "Oh, whatever." They're just happy with the news, whatever. But I would say if you're listening to this show, it is not intentional and certainly not coming from a bad place.
I was just going to say, would you like to offer a blanket apology to all those whom you've offended over time?
In so many ways, in every way.
I personally like you have you say things that are like the way I describe you. I'm like first of all I started with I love Dr. Jain. Like he is so good. I mean you just have a good bed. You mean well. You have a good bedside manner. I'm like sometimes he'll say things that will be in his inside voice, but they come out his outside voice. So you have to just kind of be able to bob and weave. And if you're hyper emotional and he says something that should be in his inside voice, you may have to take a couple of deep breaths and just know that was supposed to be like state in here in this little area.
Yeah. Well, I will, full disclosure, I was told in my first year when I was practicing in Chicago, a tremendous staff there. I learned so much over there my first year out of fellowship. One of the nurses there told me, I think I had like some run of like 13 or 14 straight like successful pregnancies from transfers, right? So it was like, here's me like right out of training, first 6-7 months out, right? And like I'm on this roll and I'm like, I'm the greatest thing since sliced bread. Everything's perfect, right? Like whatever. Number 15 or 16, whatever it was a negative test. And I remember feeling so bad about it. And I called the patient and I was like, I was genuinely upset. And one of the nurses, she's been doing this for about 10 years, pulled me aside and said, Dr. Jain, you have to be more like Dr. So-and-so who doesn't get emotional about this stuff because you won't survive. Now, this was in 2007, right? Like 2008, early 2008. And I would say the only thing that probably keeps me wanting to get up and do this every day is the emotional connection that you have to it. There's no other reason that I would really want to do it. You mentioned money earlier in our conversation. We all want to get paid for the job we do, right? But like, I don't get up in the morning thinking I can't wait to make whatever in a day I would make, right? Like it doesn't matter. Like
if I were you, I'd be like, ching, this is what I'm gonna make Monday. Ching. Then what Tuesday?
Well,
oh yeah, I'd be calculating that shit on the way to work, like.
But can I tell you something? And you know this. You're gonna want to do better the next day, and the next day, and the next week, and the next month, and then the year-to-year graph that you look at. Oh, I want to whatever, and that's good. That's a sign of, I guess, working hard and development and growth and all that stuff. That doesn't necessarily reflect success in terms of like baby success, right? Doesn't necessarily it doesn't really reflect like, I personally feel like it takes the joy out of it. I think the best way to put it is most physicians would say, we're very fortunate to be in a field where you hopefully you love it, you're doing good, and you don't have to worry about money. Right? Like it's one thing, if you're doing it for the money, that's going to get really old really fast, right? Because it's usually not something that you can, for lack of a better term, like scale, right? To be like, okay, I'm seeing blank number of patients a day. I'm going to scale that to whatever. Okay, there's a limit. Now you can't really, you can get physicians assistants and nurse practitioners, and that's great. I use them. Two tremendous physicians assistants that, been with me now for 2 years now, and you can grow things that way, but that's business growth and it might be financial growth, but I don't know if you get that daily joy in what you do from that. I'm not saying those are bad things. Those are great things. And the people who do them well can do them. There's fertility doctors that have national businesses that are, if you want to use money as a sign of success, they're second to none, right? But on the flip side, this daily connection that we make with people, right? Each embryo transfer, I think I had 4 embryo transfers this afternoon, right before I came here today. And I expect all 4 to work. I'll be really upset next Wednesday if only 3 worked.
Yeah.
Or if less than 3 worked. It's like I'll only be happy if all 4 worked, right? But on the other hand, I can see where if you let the emotion get into it too much, it can wear you down. But going back to how this conversation started about like, when you think about like, you made the comment about like, hey, do you put your foot in your mouth sometimes and, say things? It's like I do, because I kind of wear it on my sleeve, and I kind of just, I really enjoy what we do and the connection we make with patients. And if I could never be like that professorial, the physician that only says the bare minimum. And you're
I'd
oh
like
my
to see
God.
you try, because that'd be really funny. Oh my God, it's so
Wait,
good.
by the way, when you say slides, you
They
mean
just
like
slide in.
shoes?
Yeah, they just slide in.
slip-ons.
Hang out. Just stick with me. I'll get you with all the lingo.
I'm impressed that you are as up on lingo as you are. I mean,
I don't know if you should be impressed or alarmed.
why.
Who knows? Because I'm over here. I don't know what's happening over here.
Well, your kids, they're too young to realize it now, but they're like a super cool mom. Like you'll be one of the cool moms that kind of, keeps them.
We will see. We will see. Well, I appreciate you coming in. This has
All
been
my pleasure.
This has been just a joy. I know you're busy. I know you have lives to create. So thank you for spending, 60 minutes with me.
was all my pleasure.
And I plan on, believe me, you're coming back. This ain't the last time your ass will be in this seat.
I would love to do like an OBGYN fertility doctor thing with Dr. Shepard.
We're gonna
How
do
cool would that
we're
be?
gonna do a threesome with Shep Dog. She's coming in 2 days. I'll lube her up, get her ready to go.
Okay.
I meant lube in the like get her
Drunk? Buzzed? When people say lubed up, don't they mean like kind of like
Yeah, I just meant I
buzzed a
greased the skids with Shep Dog to say,
Oh.
do you want to do a threesome with Dr. Jain? And see,
Yeah.
this is going nowhere fast. And with that, if you're still following your girl, please follow me on YouTube, Spotify, Apple, or wherever you get your podcasts. And until next time, keep moving.
Thank you.
How fun.
That was fun. Can I wear these in life? Can I just walk around and like talk to people and only hear them through this? This is amazing.